All right. Hello, everybody. I want to go over a paper that was done in, it was titled Conservative Management of Cervicogenic Dizziness Associated with Upper Cervical Instability in Postural and POTS. I feel I commend them. I'm glad that they did this. However, they referenced a couple of my papers, and I feel it was referenced inappropriately, and I feel like that there are some issues with it. Now, I applaud the fact that providers are now starting to look at this pathology as my wife and I and several others have been looking at this pathology for 20 something years, and we've been ridiculed. So I just kind of want to go over this and kind of show a little bit of what we're doing and what I feel is somewhat inaccurate with this paper. So let me just go and show you here, and thank you all for watching. So in the paper, they mentioned that the chiropractor considered the possibility of cervical instability and post-concussion syndrome in order to cervical spine radiographs, including static and dynamic views. The lateral view demonstrated a straightening of the cervical lordosis. Now, uh, they did a flexion extension view, which some people call dynamic, but true dynamic is true digital motion X-ray fluoro at 30 frames per second. And that's what we published in our almost 200-person paper looking at instability and upper cervical instability in the symptomatic and asymptomatic population. So from their paper, they had they said the loss of the cervical curve. Now, straightening or loss of the curve doesn't mean anything unless you actually measure it. You can't eyeball it because then it's just subjective. The same thing here, they mentioned that there's no abnormal listhesis, which is a slippage of the vertebra or sign of instability. Now, instability on flexion extension, you're just looking at the anterior and posterior column, and you're looking at an angulation and translation. But they did mention in the paper that the curve is relatively straight. Now, I don't know what relatively straight means. It's the same thing here with flexion that they did. They said that there didn't appear to be, there's no abnormal listhesis or signs of instability. Well, how do you know that? You can't eyeball it. I can eyeball this and I already see signs of instability. Signs that if we did this on our dynamic paper that they referenced, there would be signs of instability. But this is subjective. There's no measurement, and we're trying to eyeball a few millimeters, which is inaccurate. The same thing here. Look at the extension view. And again, this paper used one person. Look at what's called the posterior aspect of the vertebral body. This suggests that there's probably damage of the anterior longitudinal ligament, and that would measure most likely more than a few millimeters, which is suggestive of a listhesis and instability. So right off the bat, when I eyeball this in the paper where they say there doesn't appear to be there or there is none, you can't just say that. You have to measure it because I can come in and say, I see listhesis, I see instability, but there's an established normal that has to be measured. So right off the bat, when they say, hey, it doesn't appear there is any, there appears there is, but it's subjective. So there's no objective measurements. That's like me looking at you and saying, you look like you have high blood pressure, but I don't use a blood pressure cuff. Same thing here. They said the spine appears relatively straight. We'll measure it. Relatively straight to what? I can come in and say that looks relatively normal. Someone else can come in and says that looks relatively horrific. There's tons of evidence, papers that I publish in Journal of Brain Circulation, and tons from Chiropractic Biophysics nonprofit that has hundreds of articles on what is a normal spine and what that normal range is. But it has to be measured. So right off the get-go, it appears there's listhesis, it appears there's instability, and relatively straight to what? These numbers are already identified and they're in the literature. So how can we write a paper using subjective terminology and measurements? You can't. This is how you measure on flexion extension according to tons of literature and research, articles that I've been associated with, and even the AMA guidelines. You have to measure the angulation and the translation. You can't eyeball it. None of that was done in this paper. So you can say there's no listhesis, there's no instability, but we don't know that. And it actually appears that there is. the same thing. This is from their measurement. They did a static X-ray, not dynamic. And they referenced the paper that I published. And there's no measurement of the periodontal space, but there's also inaccurate landmark. The landmark, they measured it at the, almost looks like a spur formation of the lateral mass of where it ends, not at the correct area. So if you were to measure it from the correct area, I don't even think this would constitute as upper cervical instability based on the paper that I wrote that they referenced in their article to say it appears there is. Sorry, this is pixelated, but you measure it from the where the transverse process meets the lateral mass, not where the bone spur formation is that makes that lateral mass wider. So it's inaccurate. And I don't think if you were to measure it where those landmarks are, I don't even think this person would be considered to have upper cervical instability on that view. So the paper that they referenced that I'm discussing that I showed a picture from is Diagnostic Accuracy of Video Fluoroscopy for Symptomatic Cervical Spine Injury Following Whiplash Trauma. This was on approximately 200 patients. And we looked at symptomatic versus asymptomatic. And as you can see, where that red line is, that is where the transverse process meets the lateral mass, not the inferior margin of the lateral mass where there may be a spur widening it. So I don't even think they measured it accurately, and they referenced my paper if that's how they did it. Not only was the measurement wrong, but they also used static imaging, which we're going to talk to. So we did a paper that they also referenced where we did multiple cases with patients with abnormal cervical curve and upper cervical instability, and we improved the cervical curve as well as upper cervical instability. And how do we know that? Because it was measured. So they also did in their paper, they did a dynamic X-ray of open mouth. That is not what our paper showed. Our paper showed it needs to be 30 frames per second movement. Static, you can get it, right? Because if you pause the DMX, it's an X-ray. But after doing, I would probably say tens of thousands of these now, trying to do a static X-ray to get this correct and accurate, incredibly difficult. So just have your doctor refer out for a digital motion X-ray, just like they would for an MRI. They didn't use the most accurate test to determine, and they referenced our paper that that's how they did it, which is not how they did it. So again, here's something we showed. This is the same patient that came from another office. They did static, we did DMX. It went from not unstable to significantly unstable because there's so many parameters of movement that occur there. Getting it right is incredibly difficult. So they didn't even use the appropriate diagnostic test that we showed to be incredibly accurate. So I do believe that they inaccurately placed the landmark. I do believe it was less than 3 millimeters of what our paper showed. So I don't even think they had upper cervical instability on this plane. They didn't measure. The other measurements, as I showed you, they didn't measure. They eyeballed it. So I don't know if these places got better or worse. And there is no pre and post. In all of our papers, we had this pre and post imaging when we showed changes that they referenced. They did not show if the curve got better. They did not show if the upper cervical spine, from what they determined to be unstable, got more stable. They did not show if there was more or less instability. One, they couldn't do a pre and post because none of it was measured. But how can you say that you improved these pathologies when you never measured to start with, and then you never did a pre and post? I don't understand. In our office and what we did in our paper with the upper cervical instability management and curve is we measured every single segment. We measured the curve as a whole. We measured the upper cervical, and then we compared them. And we were able to show if they improved. Like this is a patient we just did few weeks ago. And as you can see, we dramatically improved his curve. We dramatically improved his instability in the mid-cervical spine as well as upper. So again, I applaud people for looking at this, but also I'm not here to start a fight. I'm here to be a voice for patients that have been suffering with upper cervical instability that have been blown off. And now it's a hot topic. So everyone's trying to jump on this wagon, help them, which is great. But there's studies out there that have been shown that can really help as opposed to saying, hey, look, we did something, come to me now because we can help it. Like maybe they can, but this paper does not show that it helped upper cervical instability. And the papers that they referenced to mine, they did not reference it accurately. So I hope that you found this to be helpful. And if you have any questions, please let us know. My name is Dr. Evan Katz of Katz Chiropractic in Boulder, Colorado. Thanks so much. Have a wonderful day.